Hello, my name is Eve Henderson, and the policy that my group decided to research for this project was the Tobacco 21 law, or the T21 law for short. We got inspiration to research this policy because whether it be middle or in high school, we noticed we had similar experiences with noticing a lot of students engaging in using e-cigarettes or vaping, and it led us to wonder what policies are in place and what future activities and what future policies may need to be in place to help combat this health issue. So without further ado, we will get into what this policy means and what it's about. So as I said, this policy is called the Tobacco 21 Rule, or T21. This policy raises the minimum legal sales age for tobacco products, which includes e-cigarettes and vapes, from 18 to 21. With this policy, all retailers in the US would require ID verification for consumers who wish to purchase tobacco and e-cigarettes, anything with tobacco in it, basically in general, to help prevent and curb young buyers from purchasing that and using it irresponsibly and resulting in any negative health issues. This would require regular compliance. This is a mandatory order, meaning that all 50 US states and US territories must follow it. It is not optional. And local states, cities, and counties can also implement stricter rules or create their own kind of variation of this rule in combination with this national policy as well. So we cannot address this policy first without addressing the growing issue with vaping and the use of e-cigarettes, particularly among youth and young adults. Research has shown that it is consistently a growing public health concern. It is often marked for youth and young adults as a safer or a healthier alternative to traditional cigarettes. However, various scientific research studies and articles have shown that using e-cigarettes can be just as dangerous as traditional cigarettes, if not more dangerous, and can um, very much have long-term health effects that are still being studied, such as lung issues and cancer, for example. However, this information isn't very consistent and it isn't widely available for the general public to really inform themselves. So as a result, this can catalyze health risks and cause people to undermine how dangerous these products can be until something bad happens or if an emergency occurs. So as a result of that, this also places a burden on our public health system regarding concerns like respiratory issues, chronic disease, addiction, and the rapid increase of nicotine addiction among adolescents and young adults. So as a result, Tobacco 21 helps address this by reducing youth rates regarding vaping, using tobacco, e-cigarettes, etc., and also limiting early exposure to nicotine and preventing those lifelong addiction patterns and unhealthy behaviors. Of course, because vaping is such a nuanced issue, we must go over the social determinants of health. The social determinants of health, how I define it, is they're basically the everyday conditions that influence our health outside the doctor's office. So, regarding nicotine use, for example, there are various determinants of health that it can influence, such as economic factors, health literacy, and the environment and the community. For example, regarding the built environment or one's community, youth who live in areas with easy access, low law enforcement, urbanite areas, those who live in low income communities, and those who live in communities with heavy tobacco marketing or advertising are more likely to be exposed not just to those products firsthand, but also they'll be at an increased risk of using those products. Another factor is one's social networks, or basically one's social relationships, whether this be with peers, good friends, family members, or even older peers who are of age to purchase those products. And the normalization of using those in one's social circle can help also. It increases the risk of youth and young adults potentially engaging in this behavior and also using that product. Additionally, because this is a healthcare issue, there are clear disparities regarding access to healthcare. For example, if there is limited access regarding effective intervention strategies, prevention programs, counseling, or resources to help youth and adolescents who want to quit to stop smoking, or perhaps those are in place in their community, but they're of poor quality. Um, that can make or break if youth and young adults quit this bad habit, which can obviously make it harder. This can be a potential barrier for potential youth and young adults who want to quit. And as a result of these, if they aren't addressed or perhaps made easier access, this could actually increase their risk of engaging in this behavior and further damaging their physical health, but also their mental health as well. So this is why policy like Tobacco 21 is so essential for the protection and our prevention of this issue to help address early nicotine exposure and those ongoing health disparities. So is this policy local, state, or national? From our research, we have discovered that Tobacco 21 is a national policy. Some aspects that make this policy so widespread include the sales and the convenience of purchasing these products, but also the consistent consumption. So regarding sales or convenience, the consistent and often misleading promotion of e-cigarettes today, not just in retailers and stores, but also through media, television, and movies, um, it can make it very much look like that it is easy to access and that it is normal to use. So obviously, if this product isn't easy access and there's little to no guidelines regarding purchasing this, especially in low income areas, then this is going to cause a drastic increase in the use of these products, especially amongst those who may not have even thought about smoking in the first place regarding vaping or e-cigarettes. As regarding consumption, it is very much known that the use of e-cigarettes is popular amongst youth and young adults. And as a result, they have become the top consumers of these products, which is why an age restriction regarding this policy is so imperative and appropriate. The groups that are heavily influenced by this policy and also this issue include, but not limited to, young adults, teenagers, adolescents, healthcare workers, health providers, etc. So is this policy debated or is it impacted? It is both impacted and debated amongst various community members of the community and also in politics due to the legal restrictions. Two of the main arguments that we kind of noticed in our research was regarding sales and also raising the age requirements. So some communities argue that by raising the age requirement from 18 to 21 is actually an infringement of one's autonomy or one's personal liberty. I actually found this argument to be very interesting because I never realized that people felt so strongly about that regarding this issue, and I thought it was very unique and quite interesting to look at. Regarding sales, this is really in the perspective of retail companies, tobacco manufacturers, and employees of these establishments. They argue that by implementing this policy, it can actually impact or drastically reduce their profit and revenue as a result. And also, people in these industries would lose their jobs or significantly have a hard time getting their products out there, which can make their jobs harder. Regardless, though, From various research, we've learned that from Tobacco 21's implementation, almost 50%, there was almost a 50% reduction in the smoking rate among high schoolers. So evidently, this policy, despite the opposition and criticisms from these communities, has been shown to be incredibly sustainable with decreased risk and increased health benefits. So regarding health impacts, there were various health changes. Obviously, with the implementation of Tobacco 21, it makes it harder for companies who advertise these products to reach the younger generation and make it seem trendy or even normalized. So as a result, they lose their top consumers, and also youth and young adults can learn to take advantage of their health and learn to resort to more alternative behaviors regarding cigarette smoking or vaping with e-cigarettes. Also, with this in place, various research studies have discovered reduced addiction rates thanks to campaigns funded not just by public health organizations, but also some state organizations. It has now helped people understand the risk of using these products and what people can do if they notice themselves or their loved ones getting addicted to these substances, what they can do to help improve their lives for the better. So what is the feasibility of this policy? The feasibility of this policy is highly feasible. It is currently used and is still enacted across all 50 states and US territories. It was enacted around December of 2019 under the Trump administration, and it took effect immediately. There was no grace period, in other words. This policy resulted in lower rates of smoking among young adults and has resulted in increased long-term health gains, such as, of course, increased physical health, a healthier workforce, particularly among younger adults, reduced healthcare costs, high cost benefits, or actually, excuse me, high cost effectiveness, I should say, and also decreases in chronic diseases, such as those regarding the lungs, asthma, and even rates of cancer. However, there are some challenges regarding feasibility of this policy. One includes retailer compliance, which is basically, what is in place to make sure that local retailers are actually, checking for IDs of their consumers to make sure they're of age when selling these products. And also regarding the access to e-cigarettes through older peers. So particularly if younger peers who are not of age to buy this physically in the store, they may gain access through older siblings or perhaps older peers of age. So I think that's also a potential issue regarding the feasibility of this policy. So that leads to the question if this policy can be enforced. In summary, yes, this policy can be enforced, and it is still enforced today, mainly through the Food and Drug Administration. As a result of its enforcement, retailers in the United States are required to verify individuals of age to purchase tobacco products. Potential punishments put in place that retailers could face include, but aren't limited to, employee criminal charges, hefty fines, and also temporary or permanent suspensions of the license to sell tobacco-related products in their stores. What is the budgetary impact for this implementation? Regarding finances, there is really little impact for retailers. Specifically, retail sales and revenue are really the only area that T21 affects regarding retailers. As for federal and state governments, it is costs for this implementation, this policy, is taken care of by the currently existing FDA programs that help target not just vaping and smoking, but also other FDA policies or interventions in place. In summary, this budgetary impact for T21 has resulted in various long-term health benefits, such as reduced healthcare costs, reduced insurance costs, and also a healthier workforce. So in summary, Tobacco 21 is a low-cost policy with very large benefits for individual health and also the healthcare system. Oops. So regarding long-term sustainability and the budget, the funds are particularly used long-term for current inspections, so making sure that retailers are complying with the program and also, are doing it responsibly and safely. Research updates to make sure that this policy is producing effective and positive results. Community outreach, alerting the community basically about what intervention or therapeutic programs are in place to help with this issue, and also youth prevention programs. This funding primarily comes from not just federal budgets, but also state public health budgets. And without these funds and the stable budget, maintaining such policies and interventions can make protecting public health much more difficult, which is why it is so important that discussions regarding policies like these need to be addressed, but also fixed if needed. So regarding the literature of this policy, there was really no positive or negative impact. It was really a mix of both. Obviously, the positive impacts of this policy included increased awareness about the risks of vaping and e-cigarettes, and also increased interventions and therapies to help support smoking cessation. And also by increasing the age from 18 to 21, that significantly has reduced vaping rates among youth and young adults. However, this does not come without challenges. For example, enforcement varies between states and there are uneven results, which I feel like can really depend on how strict the implementation is, because obviously if the implementation is not strict, then the results may not be as positive or perhaps as applicable, if you know what I mean. Additionally, as I mentioned previously, some individuals may turn to Black market products or perhaps turn to online products regarding e-cigarettes because they cannot get these in person. So overall, T21 has both positive impacts and potential negative impacts that need to both be addressed. So last but not least are barriers and strategies regarding the implementation of this policy. So I wasn't able to exactly get all of this on the PowerPoint, so I had to type this out. But overall, barriers to enforcement in retail, excuse me. Potential barriers to the implementation of T21 could be, like I said previously, resorting to Black markets or the purchase of e-cigarette products online. I think to help reduce that barrier would be perhaps online enforcement and also stronger age verification technology for online sales. Additionally, to help reduce, the carelessness of not checking an individual's ID in an in-person store regarding the selling of tobacco products, providing standardized training for not just employees, but also managers to help check those IDs. Additionally, another barrier, I think, for the implementation of this policy can be community engagement. I feel like, if this policy is in place, but people do not know exactly how to get the word out there about not just policy, but also potential intervention strategies or therapies, then you're not going to see very big positive results. So I feel like a way to help resolve this issue would be to involve the entire community, schools, parents, and local organizations in awareness campaigns, and also to increase federal and state funding, also if finances are a potential issue. So here are the references in case anybody is interested in looking at this issue any further. But to wrap up, Tobacco 21 is a feasible and enforceable cost-effective policy. It is shown to reduce youth access to nicotine, improve public health, and has saved billions of dollars in U.S. healthcare costs. So while this issue is constantly debated, the long-term benefits are clear and is essential for help protecting our future generations' health and also advocating for improved public health among our communities. So some future questions to consider, which unfortunately I did not get to write in the PowerPoint, that need to be addressed would be, for example, what role would local organizations, parents, or schools have in reinforcing the goals of Tobacco 21, since this issue is targeted towards not just youth, but teenagers and young adults? And additionally, how can policymakers measure long-term success of Tobacco 21 beyond just reduced smoking rates, such as healthcare costs, addiction disparities, workforce health, etc.? So that concludes the presentation for this group. I hope everyone has a wonderful rest of the semester. And thank you for listening.